Hello, good day, nursing students. Welcome to NCM 101 Health Assessment. I am Ma'am Christine Uyerhena, one of the clinical instructors in the College of Nursing in Xavier University. So for our first topic in your NCM 101 orally, we will be discussing about collecting the objective data and the physical examination. In this first lesson, we will only tackle the objectives, guidelines, and some key important details that you'd need to know about the physical examination. We will delve deeper as to how to do a detailed examination in each part of the body in the succeeding lessons or topic. So buckle up and let's start. I would just like to inform you, class, that the topics or the lessons that are discussed in this video can be found in your Health Assessment in Nursing by Weber and Kelly, the 6th edition, in pages 31 and 43. So let us first talk about our learning objectives. So at the end of this pre-recorded video, the student will be able to explain how to prepare oneself, the physical environment, and the client for the physical examination. Survey the various pieces of equipment needed to perform a physical examination. Describe various gland positions used for different parts of the physical examination, and demonstrate correct inspection, palpation, percussion, and auscultation examination techniques. So these are some of the general principles that we follow while doing the physical assessment. A complete or partial physical examination is conducted following a careful, comprehensive, or problem-related history. It is conducted in a quiet, well-lit room with consideration for patients' privacy and comfort. When possible, begin with the patient in a sitting position so both the front and back can be examined. Conduct the examination systematically from head to foot so as not to miss observing any system or body part. While examining each region, consider the underlying anatomic structures, their function, and possible abnormalities. Because the body is bilaterally symmetric for the most part, compare findings on one side with those on the other. Explain all procedures to the patient while examination is conducted to avoid alarming or worrying the patient and to encourage cooperation. So what is an objective data? A complete nursing assessment includes both the collection of the subjective data and the collection of the objective data. Objective data include information about the client that the nurse directly observes during the interaction with the client and the information elicited through the physical assessment techniques. To become proficient with physical assessment skills, the nurse must have basic knowledge in three areas. So the first would be types and operation of equipment needed for the particular examination. Example, do we need a pen light, a sphygmomanometer, an otoscope, a tuning fork, or a stethoscope? Another would be preparation of the setting, oneself, and the client for the physical assessment. And the third would be performance of the four assessment techniques, which are the inspection, palpation, percussion, and auscultation. Each part of the physical examination requires specific pieces of equipment. For example, we need gloves and gowns to protect the examiner in any part of the examination. When the examiner may have contact with blood, body fluids, secretions, excretions, and contaminated items, or when the disease-causing agents could be transmitted to or from the client. When taking the vital signs, we need a sphygmomanometer, a thermometer. It can either be oral, rectal, or tympanic, watch with second hand, and a pain rating scale. For eye examination, we can get a pen light, a Snellen chart, ophthalmoscope, cover card, and newspaper. And also, for example, if we want to check the abdominal area of our client, we need a stethoscope so that we could detect the bowel sounds, a measuring tape, and maybe some pillows that could help when we position the client. So prior to the examination, collect the necessary equipment and place it in the area where the examination will be performed. This promotes organization and prevents the nurse from leaving the client to search for a piece of equipment. So how do we prepare the physical setting? The physical examination may take place in a variety of settings such as a hospital room, outpatient clinic, physician's office, school health office, employee health office, or a client's home. It is important that the nurse strive to ensure that the examination setting meets the following conditions. First, we have a comfortable warm room temperature. Provide a warm blanket if the room temperature cannot be adjusted. Another would be private area free of interruptions from others. Close to the door or pull the curtains if possible. Another would be quiet area free of distractions. Turn off the radio, television, or other noisy equipments. Adequate lighting. It is best to use the sunlight. However, good overhead lighting is sufficient. A portable lamp is helpful for illuminating the skin and for viewing shadows or contours. Firm examination table or bed at a height that prevents stooping. A roll-up stool may be useful when it is necessary for the examiner to sit for parts of the assessment. And lastly, a bedside table or tray to hold the equipment needed for the examination. As a beginning examiner, it is helpful to assess your own feelings and anxieties before examining the client. Anxiety is easily conveyed to the client who may already feel uneasy and self-conscious about the examination. So these are just the general principles to keep in mind while performing a physical assessment, and this includes the following. So it is very important to wash hands before beginning the examination, immediately after accidental direct contact with blood or other body fluids, and after completing the physical examination or after removing gloves. If possible, wash your hands in the examining room in front of the client. This assures your client that you are concerned about his or her safety. Second, always wear gloves if there is a chance that you will come in direct contact with blood or other body fluids. In addition, wear gloves if you have an open cut or skin abrasion. If the client has an open or weeping cut, if you are collecting body fluids for specimen, and if you are handling contaminated surfaces, and when you are performing an examination of the mouth, an open wound, genitalia, vagina, or rectum, change gloves when moving from a contaminated to a clean body site and between patients. The third, if a pin or other sharp object is used to assess sensory perception, discard the pin and use a new one for your new client. And lastly, wear a mask and protective eye goggles if you perform an examination in which you are likely to be splashed with blood or other body fluid droplets. Example would be if you are performing an oral examination on a client who has a chronic productive cough. So how do we approach and prepare the client? Establish the nurse-client relationship during the client interview before the physical examination takes place. This is important because it helps alleviate any tension or anxiety that the client is experiencing. At the end of the interview, explain to the client that the physical assessment will follow and describe what the examination will involve. We have to respect the client's desires and requests related to the physical examination. Some clients' requests may be simple, such as asking to have a family member or a friend present during the examination. Another request may involve not wanting certain parts of the examination to be performed. In this situation, you should explain to the client the importance of the examination and the risk of missing important information if any part of the examination is omitted. Ultimately, however, whether to have the examination is the client's decision. Some healthcare providers ask the client to sign a consent form before a physical examination, especially in situations where a vaginal or rectal examination will be performed. In continuation, if a urine specimen is necessary, explain to the client the purpose of the urine sample and the procedure for giving a sample. Provide him or her with a container to use. If a urine sample is not necessary, ask the client to urinate before the examination to promote an easier and more comfortable examination of the abdomen and genital areas. Ask the client to undress and put on an examination gown. Allow him or her to keep on underwear until just before the genital examination to promote comfort and privacy. Leave the room while the client changes into the gown and knock before re-entering the room to ensure the client's privacy. Begin the examination with the less intrusive procedures such as measuring the client's temperature, pulse, blood pressure, height, and weight. These non-threatening, non-intrusive procedures will allow the client to feel more comfortable with you and help ease the client's anxiety about the examination. Throughout the examination, continue to explain what procedure you are performing and why you are performing it. This helps ease your client's anxiety. It is usually helpful to integrate health teachings and health promotions during the examination. Approach the client from the right-hand side of the examination table or bed because the most examination techniques are performed with the examiner's right hand. You may ask the client to change positions frequently depending on the part of the examination being performed. Prepare the client for these changes at the beginning of the examination by explaining that these position changes are necessary to ensure thorough examination of each body part and system. So let us now talk about the physical examination techniques. It is good to remember the mnemonics IPPA, which stands for inspection, palpation, percussion, and auscultation. These are the 4 basic techniques that must be mastered before you can perform a thorough and complete assessment. But we have to take note that when we assess the abdominal area of our client, we first do inspection, then auscultation, then percussion and palpation. Usually the auscultation comes first before percussion or palpation because palpation may alter the character of the vowel sounds. So first, let us talk about inspection. Inspection involves using the senses of vision, smell, and hearing to observe and detect any normal or abnormal findings. This technique is used from the moment that you meet the client and continues throughout the examination. Inspection precedes palpation, percussion, and auscultation because the latter techniques can potentially alter the appearance of what is being inspected. Although most of the inspection involves the use of the senses only, a few body system requires the use of special equipments, example, ophthalmoscope for the eye inspection and otoscope for the ear inspection. So we use these following guidelines as we practice a technique of inspection. First is we make sure the room is comfortable and the temperature of the room is comfortable. A too cold or too hot room can alter the normal behavior of the client and the appearance of the client's skin. Use good lighting, preferably sunlight. Fluorescent lights can alter the true color of the skin. In addition, abnormalities may be overlooked with dim lighting. Look and observe before touching. Touch can alter appearance and distract you from a complete focus observation. Completely expose the body part you are inspecting while draping the rest of the client as appropriate. Note the following characteristics while inspecting the client: the color, patterns, size, location, consistency, symmetry, movement, behavior, odors, or sounds. Compare the appearance of symmetric body parts, example eyes, ears, arms, hands, or both sides of any individual body part. Next is palpation. Palpation consists of using parts of the hand to touch and feel for the following characteristics: the texture, is it rough or smooth? Temperature, is it warm or cold? Moisture, is it dry or wet? Mobility, fixed, movable, vibrating. Consistency, is it soft, hard, fluid-filled? The strength of the pulse, is it strong, weak, thready, or bounding? The size, is it small, medium, large? The shape, well-defined or irregular? And degree of tenderness. 3 different parts of the hand, the finger pads, ulnar palmar surface, and the dorsal surface, are used during the palpation. Each part of the hand is particularly sensitive to certain characteristics, so we need to determine which characteristics we are trying to palpate to find which part of the hand is best to use. In general, the examiner's fingernails should be short and the hands should be a comfortable temperature. Standard precautions should be followed if applicable. Proceed from light palpation, which is the safest and the most comfortable for the client, to moderate palpation, and finally to deep palpation. Specific instructions on how to perform the 4 types of palpation follow. So the first is the light palpation. To perform light palpation, place your dominant hand lightly on the surface of the structure. There should be very little or no depression, less than 1 centimeter, and feel the surface structure using a circular motion. Use this technique to feel for pulses, tenderness, surface skin texture, temperature, and moisture. With moderate palpation, we depress the skin surface 1 to 2 centimeters with your dominant hand and use a circular motion to feel for easily palpable body organs and masses. Note the size, consistency, and mobility of the structure you palpate. For the third type of palpation, which is the deep palpation, place your dominant hand on the skin surface and your non-dominant hand on top of your dominant hand to apply pressure. This should result in a surface depression between 1 to 2 inches. This allows you to feel very deep organs or structures that are covered by thick muscles. And the last type of palpation is the bimanual palpation. Use two hands, placing one on each side of the body part. Example, when you palpate the uterus, the breast, or the spleen. Use one hand to apply pressure and the other hand to feel for the structure. Note the size, shape, consistency, and mobility of the structure you palpate. The next technique will be percussion. Percussion involves tapping body parts to produce sound waves. These sound waves or vibrations enable the examiner to assess the underlying structure. So percussion has several different assessment uses, including eliciting pain. Percussion helps detect inflamed underlying structure. If an inflamed area is percussed, the client's physical response may indicate, or the client will report, that the area feels tender, sore, or painful. Determining location, size, and shape. Percussion note changes between borders of an organ and its neighboring organs can elicit information about location, size, and shape. Determining the density. Percussion helps determine whether an underlying structure is filled with air or fluid or is a solid structure. Detecting abnormal masses. Percussion can detect superficial abnormal structure or masses. Percussion vibrations penetrate approximately 5 centimeters deep. Deep masses do not produce any change in the abnormal percussion vibrations. Eliciting reflexes. Deep tendon reflexes are elicited using the percussion hammer. So there are three types of percussion. First would be the direct, second would be the blunt, and the third would be indirect or mediate. Direct percussion is the direct tapping of a body part with one or two fingertips to elicit possible tenderness. Blunt percussion is used to detect tenderness over organs by placing one hand flat on the body surface and using the fist of the other hand to strike the back of the flat hand on the body surface. Indirect or mediate percussion is the most commonly used method of percussion. The tapping done with this type of percussion produces a sound or tone that varies with the density of underlying structure. As density increases, the sound of the tone becomes quieter. Solid tissues produce a soft tone, fluid produces a louder tone, and the air produces an even louder tone. The following techniques help to develop proficiency in the technique of indirect percussion. First, we place the middle finger of your non-dominant hand on the body part you are going to percuss. Keep your other fingers off the body part being percussed because they will damp the tone you elicit. Use the pad of your middle finger of the other hand, ensure that the fingernails are short, to strike the middle finger of your non-dominant hand that is placed on the body part. Withdraw your finger immediately to avoid damping the tone. Deliver two quick taps and listen carefully to the tone. Use quick, sharp taps by quickly flexing your wrist, not your forearm. Practice percussing by tapping your thigh to elicit a flat tone, and by tapping your puffed out cheek to elicit a tympanic tone. A good way to detect changes in tone is to fill a carton halfway with fluid and practice percussing on it. The tone will change from resonance over air to a duller tone over the fluid. So here are some of the percussion sounds. So when we talk about resonance, so if the pitch is low, intensity loud, the duration is moderate or long, and the quality is hollow, it means you have a normal lung. But if it's a hyperresonance, where the pitch is very low, the intensity very loud, duration long, and the quality is booming, it can be abnormal, or its location or example of origin is a lung with emphysema. The last technique would be auscultation. Auscultation is a type of assessment technique that requires the use of a stethoscope to listen for heart sounds, movement of blood through the cardiovascular system, movement of the bowel, and movement of air through the respiratory tract. A stethoscope is used because these body sounds are not audible to the human ear. The sounds detected using auscultation are classified according to the intensity. Is it loud or soft, the pitch, high or low, duration, the length, and the quality, musical, crackling, raspy of the sound. The following guidelines should be followed as you practice the technique of auscultation. First is we need to eliminate distracting or competing noises from the environment, example radio, television, or any machinery. Expose the body part you're going to auscultate. Do not auscultate through the client's clothing or gown. Rubbing against the clothing obscures the body sounds. Use the diaphragm of the stethoscope to listen for high-pitched sounds such as a normal heart sound, breath sounds, and bowel sounds, and press the diaphragm firmly on the body part being auscultated. Use the bell of the stethoscope to listen for low-pitched sound such as abnormal heart sounds and bruits. Hold the bell lightly on the body part being auscultated. We are done talking about the 4 techniques of physical examination. Now let us talk about positioning the client. There are different positions a client might do while doing the physical examination. In order to apply or properly assess a certain body part of a patient, we need to properly position them for effective and efficient flow of physical assessment. So the first position would be sitting position. The client should sit upright on the side of the examination table. In the home or office setting, the client can sit on the edge of a chair or bed. This position is good for evaluating the head, neck, lungs, chest, back, breast, axilla, heart, vital signs, and upper extremities. This position is also useful because it permits full expansion of the lungs, and it allows the examiner to assess the symmetry of upper body parts. The next position would be the supine position. We ask the client to lie down with the legs together on the examination table or bed if in a home setting. A small pillow may be placed under the head to promote comfort. If the client has trouble breathing, the head of the bed may need to be raised. This position allows the abdominal muscles to relax and provides easy access to peripheral pulse sites. Areas assessed with the client in this position may include head, neck, chest, breast, axilla, abdomen, heart, lungs, and all extremities. The next would be the dorsal recumbent position. The client lies down on the examination table or bed and the knees bent, the legs separated, and the feet flat on the table or bed. This position may be more comfortable than the supine position for clients with pain in the back or abdomen. Areas that may be assessed with the client in this position include the head, neck, chest, axilla, lungs, heart, extremities, breast, and peripheral pulses. The abdomen should not be assessed because the abdominal muscles are contracted in this position. The next position would be the Sims position. The client lies on his or her right or left side with the lower arm placed behind the body and the upper arm flexed at the shoulder and the elbow. The lower leg is slightly flexed at the knee while the upper leg is flexed at a sharper angle and pulled forward. This position is useful for assessing the rectal and vaginal areas. The client may need some assistance getting into this position. Clients with joint problems and elderly clients may have some difficulty assuming and maintaining this position. The next would be the standing position. The client stands still in a normal, comfortable resting posture. This position allows the examiner to assess posture, balance, and gait. This position is also used for examining the male genitalia. Then we have the prone position. The client lies down on his or her abdomen with the head to the side. The prone position is used primarily to assess the hip joint. The back can also be assessed with the client in this position. Patients with cardiac and respiratory problems cannot tolerate this position. Then we have the knee chest position. The client kneels on the examination table with the weight of the body supported by the chest and knees. A 90-degree angle should exist between the body and the hips. The arms are placed above the head, with the head turned to one side. A small pillow may be used to provide comfort. The knee chest position is useful for examining the rectum. This position may be embarrassing and uncomfortable for the client, and therefore the client should be kept in this position as limited time as possible. Elderly clients and clients with respiratory or cardiac problems may be unable to tolerate this position. Then we have the lithotomy position. The client lies on his or her back with the hips at the edge of the examination table and the feet supported by stirrups. The lithotomy position is used to examine the female genitalia, reproductive tracts, and the rectum. The client may require assistance getting into this position. It is an exposed position. The client may feel embarrassed. In addition, elderly clients may not be able to assume this position for a very long or at all. Therefore, it is best to keep the client well draped during the examination and to perform the examination as quickly as possible. These are just some key takeaways or general consideration for examining older adults. Some positions may be very difficult or impossible for older client to assume or maintain because of the decreased joint mobility and flexibility. Therefore, try to perform the examination in a manner that minimizes position changes. It is a good idea to allow rest periods for the older adult if needed. Some older clients may process information at a slower rate. Therefore, explain the procedure and integrate teaching in a clear and slow manner. To summarize, collecting objective data is essential for a complete nursing assessment. The nurse must have knowledge of and skill in three basic areas to become proficient in collecting objective data, which are the necessary equipment and how to use it, preparing the setting, oneself, and the client for the examination, and lastly, on how to perform the four basic assessment techniques. Collecting objective data requires a great deal of practice to become a proficient nurse. Proficiency is needed because how the data are collected can affect the accuracy of the information elicited. So that's the end of our lesson. Thank you very much for listening. Have a great day ahead and God bless.